Hi, welcome to our debate. My name is Bailey Arundel, and I will be introducing our group members. I am the moderator as well as the attacker for our first point. Jenna Shanko will be the second stater as well as the illustrator. Alora Caldwell will be the third stater as well as the prover. Bonnie Bender will be the first stater and will be answering questions. Anastasia Koch will be the second and third attacker. The topic of our debate is on gift giving and applied behavior analysis. In the Code of Ethics for Behavior Analysts, Code 1.06, Part D states that behavior analysts do not accept any gifts from or give any gifts to clients because this constitutes as a multiple relationship. We will present 3 sides of gift giving and discuss the pros and cons to each side. The 3 sections we will discuss are the cultural aspects of gift giving, the relationship aspect of gift giving, and other organizations' views on gifts. We, the affirmative team, believe that gifts should be allowed in our profession. Now Bonnie will present the first side on the pro side for a cultural aspect.
Thank you, Bailey, for the introduction. To begin, I want to read a quote by Shugai O'Keefe and Fallon's 2011 article on culture. They define culture as the extent in which a group of individuals engage in either overt or verbal behavior, reflecting shared behavioral learning histories, serving to differentiate the group from other groups, and predicting how individuals within that group act in a specific setting or condition. And they go on to say that culture reflects the collection of common verbal and overt behaviors that are learned and maintained by a set of similar social and environmental contingencies, so i.e. their learning history, and are occasioned or not by actions or objects like stimuli that define a given setting or context. So to those who make the challenge that the acceptance of gifts is inappropriate, I want to discuss 2 points. First, the importance of paying attention to the cultural norms, and then secondly, why gift acceptance can build and strengthen across the cultural divide. So to go on with all that, I kind of want to sort of come back around and talk about ABA in itself. So we all know that the field of applied behavioral analysis is relatively new. It's ever changing. There's continually new research coming out that impacts the types of techniques that we're using in the applied setting. And it's also expanding out across our state, our country, and across the world. So we're coming in contact with a lot of people from different backgrounds, different races and ethnicities and culture. And actually, Fong, Kataginis, Broadhead, Quigley, and Field, in their 2016 article, recommend that practitioners foster an ongoing discussion about culture within the professional organization. And the reason they say that is that there's a need to grow our awareness of culture and how it impacts our approach when we're engaging with our families and our clients. And they go on to state that we really need to be mindful about how we approach things. And by mindful, I mean understanding that our thoughts or our private events affect our behavior and how we interact with one another. So this is actually described further by Hoffman, Contreras, Clay, and Twong in their 2016 article. And they say that we should always be considerate of our clients and their families, but this is really especially important with clients of a different cultural background. And the reason why that is for 2 reasons. First of all, many of our clients with different cultural backgrounds come in with a language barrier. And then secondly, they also come in with a different definition of what's appropriate versus inappropriate. So we need to kind of have that in the back of our mind when we're moving ahead in these interactions. So if you refuse to accept a gift, it's possible that you could damage that relationship. And the language barrier, if there, could make it even more difficult because it's hard to explain your reasoning when there is a loss in the translation. And this can really further escalate hard feelings between yourself, the practitioner, and the client. So really, in all of this, who is ultimately damaged if you go this route? It's the client who's the most important entity in all of this. So the BACB's Professional and Ethical Compliance Code 2.15 states that behavior analysts act in the best interests of their clients and supervisees in order to avoid interruption or a disruption in their service. So if you offend a client's family and they choose to discontinue services, this could fall back on you. You could ultimately be in violation of this code, especially if you're aware that this is a risk before you even have this conversation with them. So that's something to really consider. Bailey and Birch further reiterate this by stating in their 2016 text that we must consider what will benefit our client the most. And in some cases, accepting a gift would be the most beneficial option for establishing and maintaining a relationship with a client and their family. It can be considered a form of pairing. And by pairing, I mean, building that relationship with another individual by following their leads, their motivations, what's reinforcing to them, and establishing yourself as a reinforcer in that relationship. And what that does is it allows for the rapport and the relationship to grow. And it also builds that trust capacity between yourself and the family. And ultimately, this is a mindful interaction. It's being aware of your private events when you're interacting with the other individual. So in thinking on this, we can consider the most important foundational goal to be the building and maintenance of that relationship between yourself and the family. That's the number one priority at the outset. And Taylor and Fisher in 2011 note that rapport building is actually necessary and a fundamental step in establishing a relationship that will be both beneficial for the client and the family. So not only does it establish buy-in from the family, but it also opens opportunities to discuss parent training opportunities with that family. And with a buy-in, you got to think that can lead to a faster acquirement of their targets, their child's targets, because they're invested in the program. They're invested in what you're doing. They trust that you have their child's best interests at heart. So they're going to be more likely to work with a child and implement the things that you've suggested to them. So although gift acceptance is frowned upon, I think it's important to remember that the concept of gift giving is a fluid and ever-changing process, and it's not static. So in that, we need to understand that the greater goal to be considered in these circumstances is that relationship. In order to build and maintain a rapport or engage in that behavior is the most important key in this, because otherwise you could damage the relationship. And in the end, like I said before, that really only most importantly affects the client. So in summary, we need to remember that we have to be mindful in our interactions, and we need to be mindful of how a refusal of a gift may damage or offend the family and ultimately the entire client support system, because the alternative is to maintaining that relationship is to be able to develop socially meaningful goals and then be able to also develop your own awareness of cultural background and to become more experienced in your interactions in this way. So thank you for taking the time to listen to my points, and I'm going to move on to the next individual.
Thank you, Bonnie, for the points that you made. I will now take the role of the attacker on the cultural stance. According to Cooper, Heron, and Heward, 2007, all professional organizations have ethical codes of behavior. Additionally, these guidelines are put into place for individuals to consider when they are making the decision regarding their professional duties. As mentioned previously, Code 1.06, Section D, is about behavior analysts and not accepting gifts or giving gifts because of multiple relationships forming. In the line of work we do, it's easy for boundaries to be crossed and for multiple relationships to form. However, it is up to behavior analysts to not let those boundaries get crossed. Allowing gifts, even based on cultural norms, can be detrimental to the relationship. It's important from the beginning to talk with parents about not giving gifts, but maybe using kind words instead. Allowing families to know from the beginning that no team member is to accept gifts can prevent future unpleasant situations for the team. Individuals from another culture come to the country with differing definitions of appropriate versus inappropriate interactions with social service, medical, and therapeutic practitioners. That said, the issue of gift giving between client and practitioner is never acceptable. We can return to the BACB's Professional and Ethical Compliance Code. It is written in multiple languages, including Arabic, Chinese, Brazilian, Czech, and among many others. Each one of these versions states the same thing regarding the Compliance Code 1.06, Section CD, regarding gift giving. Those who designed and wrote this code were practitioners from all different backgrounds and nationalities, and yet the code is clear that gift giving is never allowed. Additionally, our professional ethics are derived from what is accepted as moral norms across the world, meaning that regardless of your cultural, ethnic, or racial background, we all share the same basic moral principles. Molesky and Kielestia, 2005, reference psychologist Samuel T. Gladding, who defines ethical dimensions as autonomy, non-maleficence, beneficence, justice, fidelity, and veracity. To accept and or give a gift to a client is or give a gift to a client could potentially damage the principle of autonomy and may produce maleficence between practitioner and the client. In continuation of this thought, Brown and Transgrud recommended that practitioners practice as culturally sensitive practitioners and remain attuned to the unique cultural heritage of clients by striving to incorporate understanding of clients' cultural background in a therapeutic milieu. However, it can be argued that to do this, we need to take more care and time to explain the boundaries put in place. We can look at the Compliance Code Section 1.40A, Integrity, and note that it states that behavior analysts are trustful and honest and arrange an environment to promote truthful and honest behavior in others. BCBAs have the obligation from the very beginning to maintain an honest and open dialogue with families they work with. And when they maintain this honest and open conversation with parents, we can let them know from the very beginning that the compliance code and also even our company's policies when in regards to gift giving. And to add on to this thought, Cooper et al. 2007 discuss conflict of interest. And state that this happens when a principal party, alone or in connection with the family, friends, or associates, has a vested interest in the outcome of the interaction. Relationships that can be considered conflict of interest include financial, personal, professional, providing otherwise known as providing other services, or otherwise beneficial to the therapist in one way. Conflict of interest can be detrimental to the relationship between therapist and the family. This is why we need to err on the side of caution when it comes to accepting gifts. Also, why it's very important we continue to have an open and honest conversation with the family in regards to policies and what is appropriate. Bailey and Birch, 2016, to go on to say that the use of white lies is done in an attempt to avoid conflict or closure. This can be done at the expense of the client. So yes, in the moment, perhaps the practitioner avoided an awkward situation by accepting a gift and omitting the reason that they cannot exchange. But in the long run, this white lie could have a potential to damage the relationship in a much more impactful way down the road. In order to avoid these white lies, we need to begin our relationship with our clients using language that is clear and understandable. This means avoiding jargon, but it also means considering the cultural background and the language of the client. It's possible that in order to effectively communicate, a translator might be required. When the practitioner can be sure that the form of communication is appropriate and understandable to the client, ethical guidelines such as gift giving can be outlined. This type of antecedent intervention precedes any ethical dilemmas involving gift giving. So to wrap this up, we all work in the field, either in the past or present and in the future. It is up to us to follow the compliance code, and it was written for us. It allows us not to blur any lines and allows us to have something to look back on in certain situations, such as gift giving. We could even refer the family back to it if we need to. So now Jenna will present the PowerPoint and goes over both the pros and cons of the cultural aspect.
So the following are arguments in favor and against gift giving. Moving on to our next topic, I will be discussing the in favor for gift giving as the relational part. So going off what Bonnie stated in the cultural aspect, ABA is a very relational field. So you're dealing with people on a daily basis. You're dealing with relationships and that respect that you need. When gift giving, you create an open dialogue. It helps build relationships, trust, develops approachability, and can create an awkward situation or relationship when you decline gifts. Coming from a teacher's perspective, you create a connection with your students or dealing with clients when they give you or make you a gift. There's pride when someone creates or makes a gift for you, or even food. There's ownership to it. And when it is declined, you lose that bond. When there is a bond, the client is more likely to be acceptable to treatments and interventions, and that creates a buy-in for you. This is beneficial to both your client and you because it creates growth. Your client is more likely to work with you and commit to the treatment. There is a relational connection. When there is no relational connection, there's friction and defiance, which hinders your client's well-being and progress. They're less likely to abide in the treatment or intervention program that you have, and they're more likely to fight back with you. And that's not helping you at all. That's not helping your client especially. I believe that we should be able to accept gifts, especially if they're made from our clients. Just coming from a teacher's perspective, again, when you would decline a gift, you can see the heartache, you can see the cost. So moving on to the against favor would be Anastasia.
Thank you, Jenna. In an article by Gehrig in 2004, he identifies 3 categories of gifts. One of them is seen as a tip to the professional. And when we think of tips, we normally think of restaurants, nail salons, those kind of things. And in our profession, we do not do what we do for tips. We do it because we want to help our clients. We want to see them grow and advance as individuals. So we don't do what we do for gifts. The second point is seen as an imbalance in the professional, the therapeutic relationship. When a gift can be given as a way to fix the power differential. And we're not trying to be more powerful than the client. We're there to help them. So it's not good that they see it as that they need to regain power. And the third category of gifts is that it's seen as payment for the sacrifice to the mental health professional. That was in quotes. And yes, that would be very nice that other people see that we are all the struggle and the pain and heartache and all of the problems that can come with this job. But we're not doing it for that type of recognition. We don't need a gift to say that. Just hearing our client or the client's family saying, thank you for the hard work that you've done for myself or for my child. So those were 3 points. And in an article by Nadelson and Notman, they discuss that it's seen as a continuum where there's boundary crossings, which are much more minor, whereas it leading up to damaging boundary violations. And there's a quote from the same author, Nadelson and Notman, on page 192, and it says, "A slippery slope sometimes appears to exist, and what can be minor boundary crossings initially can become more serious if they are part of a continuum." And that's saying that it could start off as something very minor, accepting food or glasses of water or something along that line. But if you keep keep accepting those levels of gifts, that later on it could be something a little bit more up the continuum to accepting a large scale $50 plus gift. And we as a profession, that's against our code, and it just wouldn't feel right to accept that kind of gift. And same author Nadelson and Notman came up with two problematic standpoints for the acceptance of gifts, as seeing as they could be either unconscious or conscious, as an unconscious or conscious bribe by the patient to keep the client in the therapist or doctor in the doctor-patient relationship. So they want to get on their good side. And the second problematic standpoint is that it could be explicit, secret, or even explicit expectation of some reward or acknowledgement involved in performing a service or bestowing a gift, and that's in quotes. And there was a study done where they asked, in an article, Knox, Hess, Williams, and Hill in 2003, that interviewed 12 therapists, asking them about whether they had good experiences or negative experiences in gift giving or gift accepting from clients. And they were able to found a few reasons as to why that would decrease the possibility of accepting gifts. And those included that they knew that it was a boundary issue, so it listed boundary issues, the timing of the gift or the monetary amount was seen as problematic. So if it was a very expensive, one of the examples they put in was a $50 glass vase was given to a client, that seems as a problematic gift. Another reason was that it triggered a gut warning, and so the therapist just knew that it wasn't the right thing to do, that they shouldn't accept this gift. And lastly, that they saw that it could be manipulative in some way. So if you were given this $50 glass vase, later on the client could come back at you and oh, well, I gave you this very expensive gift and I'm not satisfied with the quality of your service. And they only found one reason that could potentially increase the acceptance of a gift, and that was in relation to they saw that refusing could be hurtful to either the client or the therapy process, which is important, but still that seems like a manipulation or coercive reason to actually accept the gift, and that just isn't a good reason to accept a gift. So it seems that that would be a good reason to continue to have this code of not accepting gifts, just as a safe way, so as we don't get ourselves stuck in that type of situation where a client turns around and isn't satisfied, or having little gifts lead to the acceptance of larger, more inappropriate gifts in the future. Thank you for listening, and we will move on to the next person.
So the following is just a recap of the arguments in favor and against gift giving for the relationship aspect.
Okay, so I'm going to go over the pros of gift giving and the aspect of other professions. So the main points that I want to discuss in favor of gift giving based on how other organizations view it is, first, that there really isn't no other large organization that has a ban on gifts between therapists and clients. And secondly, small gifts under $10 they don't really present a problem. So According to Zook 2016, anthropologists and psychologists have viewed gift-giving behavior as a product of interaction between psychological mechanisms and environment. Also, in the same article, it stated that despite prevalent beliefs, there are no code of ethics or guidelines of major organizations that specifically ban gifts in therapy. So other organizations, such as the American Psychology Association, or APA, have codes that mandate to avoid harm and exploitation and to respect the client's integrity. Therefore, it goes without saying that as long as the gift isn't causing harm, exploiting the client, and is still respecting the client's integrity, then it should be okay. In fact, the APA Organization Code of Ethics 2016 revised its introduction and applicability sections so that words such as reasonably, appropriate, and potentially were defined better. This is important because it clarifies the idea behind a gift and the context. It also goes kind of with what Bonnie was saying earlier, that the idea of a gift is ever-changing and fluid. It also makes it so gift-giving looks better and less unethical. Most psychologists views gift-giving as neither ethically problematic nor mind accepting small gifts. According to Fong and Cagnus 2016, small gifts can be categorized as symbolic, concrete, and moderate. So an example of a symbolic gift would be something like a poem, and an example of a concrete gift would be something like a book, and an example of a modest gift would be something homemade, such as cookies or a music CD. All of these are harmless, and even though they might not seem like much, are ways in which the client can show their gratitude. So it also has been shown that therapists are more likely to accept gifts with less money value. For example, at the center that I work at, we're able to accept gifts that are under the value of $10, which would make sense because things like books or poems or supplies to make cookies or a homemade CD generally cost under $10, and therefore are accepted more often and not considered a problem. So just to reiterate, that most large organizations don't have bans on gift giving and see it as non-problematic as long as the value is under $10. So those are the pros. We're going to move on to the next person.
Alara made a lot of good points in response to the examples of gifts she gave of books or poems. It kind of depends on what the book is. It could very easily just be any old book, or it could be 50 Shades of Grey, and it's trying to give a suggestion to the therapist. So it's just because it is a book or music or poem, it doesn't necessarily mean that it's harmless. There could be a lot of subtleties and hidden messages within the gift. Also, just if it is under a certain price, the therapist could either look at it as, oh, this is a cheap gift, or there's no way that this gift is under $10, and then kind of focus more on monetary. So not having gifts is a good way to just cancel that out and not have to worry about it. Also, as I mentioned before, that gift giving can be very exploitative, and that's why there's a lot, not many different fields have at the codes about gifts. It's more just implied and kind of more at your discretion. Whereas, so one example is engineers. they are not allowed to give or accept gifts because it would be seen as a bribe. For example, stadium building. If all of a sudden your company is giving the landowners a large, in this case, it'd be a large gift, monetary gift or tickets to something, that easily puts a foot in the door for that certain company to have the certain project. And so if we just eliminate gifts entirely, we don't have to worry about that competition of, oh, my gift is better than this company, or what if I don't get this job because someone gave $50 and I gave $100, or they gave $100 and I gave $50. So we just cut that out. And like I said, just the exploitative and just using gifts as a bribe, we don't need that. We're trying to help people. So if we just take that out, we can focus on what we're supposed to do, which is to help our clients. Thank you. We're going to move on to the next person.
All right. The following are just arguments, or the key points for arguments in favor and against gift giving with the other organization views on gifts. Next will be Alora.
Okay, so although there were some good points brought up on either side of the debate, our group has agreed that gifts should be allowed. The research that supports this would be the article by Zur, 2016. As previously mentioned, Zur states that there is no other major organization that has a code of ethics or guidelines that ban gift giving. In fact, they have revised their code of ethics to further explain terms that go along with gift giving, such as reasonable and appropriate, to make gift giving seem more ethical. Zur also mentions that gifts are more acceptable if they are small. Also, according to Ben Amos, 2018, it is disrespectful in some cultures to deny gifts. When a client presents a gift, it shows an expression of gratitude towards the therapist, therefore denying it would be rude. Also, accepting gifts is more likely to enhance the relationship and best predictor of a therapeutic outcome. It helps build the relationships between the client and the therapist. Massoff, a member of the American Psychology Association Ethics Committee in 2009, said it best. Psychologists do more harm than good if they refuse a reasonable gift. Bailey and Birch backed up this statement in 2016 when they stated under their core ethical principles that we must consider what will benefit our client the most. In the case of gift giving, it does more damage to deny the gift than to accept it. Accepting a gift is the most beneficial way to establish and maintain a relationship with the client and their family. This also allows for the client and their family to build trust. In a study conducted by Brown and Transgrud in 2016, 40 licensed psychologists took a survey on if they would accept or decline a gift. The results were that they were more likely to accept a gift from a client that were inexpensive and by cultural context presented with gratitude for good work at the end of treatment. Only 2 out of the 40 would decline a gift from a client based on a violation of the code of ethics. Okay, so that wraps up the research portion of our debate. I think we'll move on to the question and answers. So take it away.
Thank you, Laura. So the first question is, what are some preventative strategies you can use to help clients, and this includes parents and or other guardians, not offer to provide you gifts?
Thank you, Bailey. So Bailey and Birch in their 2016 text recognize and recommend that having a contingency plan in place is probably your most beneficial option, sort of like having an antecedent intervention in place. So prior to anybody having hurt feelings or a misunderstanding, a contingency plan, such as in your employee handbook manual or your parent manual, when you have an intake, having that already written in and explained within that context can put aside any misunderstandings later. Another option would also be to go over this type of recommendation or code for your business during intakes with a new hire. So again, there's no confusion then down the road about whether they should have accepted a gift or not, because it was already reviewed during the beginning weeks in their probationary time period. So I'm going to go ahead and let Bailey add in some additional points regarding this question. Thank you.
Thank you, Bonnie. So Emily McCulloch, who is a BCBA, provided 2 things that behavior analysts can do instead of accepting gifts from clients. The first thing that she discussed was being proactive. And by this, she simply meant that companies should send emails to clients and parents informing them of the code of ethics and that gifts are not allowed. This is beneficial for both RBTs and behavior analysts because then it prevents awkward situations for the staff in the future. This could also be done per BCBA during holiday seasons by talking to families and reminding them of the compliance code and the company's policy as well. The second point that McCulloch mentioned was to offer an alternative to the family. So this simply means like providing the family with opportunities such as like instead of gifts, like providing feedback to the behavior analyst or the team in general. We can remind parents that kind words mean more to us than a plate of cookies or a gift card. So I'm going to go ahead and move on to the second question that was presented, and that is, what might be some aversive consequences that can occur if you accept a small gift, like a glass of water or a $5 gift card? For example, what happens if a parent gives you a gift that you accept, but 6 months later decides that they are unhappy with the services you are providing and starts to seek out retribution? So I will pass that on.
All right, thank you, Bailey. So some things I can think of off the top of my head are the impact that a gift could have on your judgment as a practitioner. It sort of sets the tone for that dual relationship, which can get really tricky. Favors could get tossed back and forth. Favoritism can occur. And you know, down the road, if a parent gets upset with you and they decide to kind of hold that over your head, almost like in a blackmail attempt, that can be a really precarious situation. I can think of even it moving into a situation where they might start to damage your reputation. There's a lot of parents who are on a lot of different forums. Facebook is one of them. I can think of many families at the center I work with who are a part of these parent exchange forums, and they definitely exchange information on their providers. So if you're doing something that is against your code and they get upset, they could definitely come back around and use it against you. So that's something to really consider as a future or possible ramification. Not that it's necessarily going to happen, but that there is that possibility. And so that's something to keep in mind. So with that, I'm going to go ahead and let Bailey read the third and last question. Thank you.
Thank you, Bonnie. So the third question is, does anyone have any personal experiences related to this topic that they would like to share?
Thanks, Bailey. I have a personal experience, and it deals with me working in a trade school. I'm a teacher there, and a lot of our students make stuff. So we have a culinary program, and they're always baking, or digital media, they're making pictures, or even in the shops like mechanics, they're making stuff. And a lot of times they will give it to the teachers for gratitude of like what's going on, or they'll send a note or whatever. And I can only imagine denying those gifts, and then my students would be crushed. I would ruin that relationship that I'm trying so hard to build, because once I have that relationship, I have their trust and they work for me, they learn from me, putting it in as a behavior analysis perspective. If I would deny gifts, you're hurting that relationship. Again, it would be the same thing as teaching. They're not buying into that intervention. They are going to be fighting with you because they don't think that you appreciate them, or they don't think that they have your trust. Does anybody else have anything to share going along with our questions? All right, I would like to conclude this debate. The following pages are our references, and I thank you so much for listening and watching our video.